Well, I'm Dr. Brandt Gibson, and I'm excited to be here. What I want to do is actually change the paradigm, change the way that you think about treating peripheral neuropathy. The traditional way, the way that you are being told are the only options as far as treating peripheral neuropathy, are failing. They're not working the way they're supposed to. In fact, there's really three. When you get the diagnosis, so say you're sitting here and you say, okay, I now have the diagnosis of peripheral neuropathy. What are my options? Number one, most of the time they tell you there's nothing you can do. A lot of doctors are going to send you out of the room and just say, sorry, we can't help you. Good luck. That's not a good option. Option number two, maybe they're going to give you some options. They may say, here are the things that I've seen that works or I've heard work, and they throw stuff at you and they're directing your treatment. So this would be doctor-directed treatment where they literally say, here, there's a pain medication you can take, or here's a nerve modifying medication you can take, or here's some vitamins that might work. And they're just throwing stuff at it, almost like throwing spaghetti at the wall, hoping that something will stick. They're not looking at it scientifically. They're not looking at it to try to help you get better. And they're not, oftentimes, don't even give you the reasons why they're treating it the way they are. So the third option is what you're going to do because no one's giving you options. And that's where you go searching the internet and you see hundreds and hundreds of different options where people are saying, this will solve it, this will help it, this will do this. And one warning there, anybody that says they can heal peripheral neuropathy, run. Because so far, everything I've seen, everything, all the studies I've looked at, everything like that, nothing has actually been found that will heal peripheral neuropathy. There are things that can treat it, but you need to know which treatments work. And that's the problem, because symptom-related treatments, like you're doing with the internet, not a good option. Doctor-related treatments where they're not really giving you the reasons why they're treating stuff and they're really not doing anything scientific, they're just throwing stuff at it, not a good option. Doing nothing, not a good option. That's really the traditional way, the old way of treating peripheral neuropathy. And with that, you may get some good days. You may get some bad days, but ultimately when you get to the end, there's been no improvement. There's been no growth. And so what we've learned over time, I've been working with this for about 20 years, probably over 20 years, but what we've learned is you need to improve the nerve health. And the way to improve the nerve health is 4 ways. You need to first understand peripheral neuropathy and understand how it's different for you personally. Number 2, you want to manage the symptoms of neuropathy. That's really the reason you're coming in. Number 3, you need to control nerve damage. That's a huge thing. That's a huge option. That you want to make sure that you're controlling the nerve damage, because if all you do is manage symptoms, over time the symptoms get worse and the management fails. It's not working as well as it used to. And then ultimately what you want to do is you want to be able to live your life and not have peripheral neuropathy interfere in any way. Most of the time with peripheral neuropathy, you're going to have a distraction initially, then discomfort. And if you let it progress, it can get to the point where you're completely disabled and you're not able to do the things that you want to do. But what we found doing this is incomplete, because what that does, that still leaves you with doctor-directed treatment. That would be saying, okay, I've got to have someone that helps me understand peripheral neuropathy. I've got to have someone that helps me manage my symptoms. I've got to have somebody that actually controls my symptoms. But nobody lives with you. No one's with you every single day. No one knows your symptoms and exactly what's going on as good as you do. So what I want to do is I want to change the paradigm. I want to give you a new way, a completely different way where you can actually treat your peripheral neuropathy. But you're going to use these steps. These steps are very, very important. So we're going to still use those steps. And so we can take you from right here to where you can thrive with peripheral neuropathy, which is ultimately your goal. You can live the life that you want through those 4 steps, right? Understand peripheral neuropathy, manage your symptoms, control the nerve damage, and then ultimately thrive with peripheral neuropathy. And to help you do that, we've created, over a period of time, the Gibson Method. The Gibson Method gives you the tools, the steps that you need so that you can really take control of your peripheral neuropathy. And so how do we do that? Well, we're going to start with helping you understand your peripheral neuropathy, and we need to understand where you're at right now. We need to understand how bad your peripheral neuropathy is. And so what we do is we actually take you right here and we say, okay, we're going to get your neuropathy score as the very first piece. That gives you a baseline. That tells you where you're at. That tells you how severe your peripheral neuropathy is. That tells you the probability and the extent of healing. It can a lot of times tell you the number of nerves that we expect to have involved, types of nerves. That's small fiber or large fiber sensory neuropathy, motor neuropathy, and autonomic neuropathy. So that's going to give you that. And it's also going to tell you the probability of success of treatments, right? So if we start there, you get your neuropathy score. Your neuropathy score is a good first step. And from there, we're going to actually go to the next step. The next step is to get your neuropathy archetype. The archetype is a very unique diagnosis of your peripheral neuropathy. It's like a fingerprint. Everybody's peripheral neuropathy is completely unique. Nobody has neuropathy just like you. So you need your archetype so you understand exactly what your neuropathy looks like. And through this archetype, it will guide everything we need to know. That's why it's important that you understand your unique peripheral neuropathy, which will take both your neuropathy score and your neuropathy archetype, so that when it comes to managing symptoms, which of course is that next step, we're able to manage them based on your archetype, based on your unique presentation of peripheral neuropathy. And that's the next step. And so we take you to that next step where you actually say, okay, I'm going to go now to create a management playbook. And in any playbook, what you're going to do is you're going to actually understand where you're starting, what you're trying to accomplish, and the way that you do it. And that's what the neuropathy playbook is designed to do. And it does it based on your archetype. And truthfully, over time, as you're managing the symptoms, you may even be able to modify your neuropathy score a little bit because of what's going on. So as you can see, we're moving up that line and we're changing the way you are. You're no longer sitting at this level here. You're actually up here because you're managing your symptoms. And so your peripheral neuropathy is better. But if all we do is we stop there, the stool is going to fall over because it's only got 2 legs. And so we go a little bit further here. See if I'll get it to switch here for us. And the next step is to actually control the nerve damage. And the way that we control the nerve damage is twofold. We want to get your neuropathy treatment blueprint. So we've got the management playbook. That management playbook is helping you step forward, helping you move forward in managing the symptoms. And now you want to say, okay, what do I do to control the nerve damage, to treat my peripheral neuropathy? So 1, it doesn't get worse. And 2, the nerves can improve their health. And so as part of that diagnosing the cause of the treatment blueprint, you need to create a distinct understanding of what the causes are of your peripheral neuropathy. Now, the misconception is most people think, well, you have peripheral neuropathy, it must be diabetes. Well, there's 150 plus causes of peripheral neuropathy, and every single one of those could be tested. You could say, okay, I'm going to go to the doctor, and he's going to do hundreds of tests to help me understand what the causes of my peripheral neuropathy are. That would cost you a lot of time, a lot of money, and truthfully, you'll have lots of those tests that will be completely negative. So the best way to do this is to kind of streamline the process. And that's where it comes to the neuropathy diagnostic class. Through this diagnostic class, you can take 150 plus causes and you can group them into classes of 25. And in these 25 classes, you've got distinct characteristics of all those causes. And so you get distinct labs and tests that you could actually do to determine if that's the type of peripheral neuropathy that you have. That diagnostic class is the key, because then you can actually just do testing based on additional information on what's going on with you. So basically looking at your history, looking at the risk factors and so forth, you can say, okay, we're going to test for this class. And then based on positive or negative results from that class, you'll know what treatment options are available as well. And so it guides the treatment blueprint. So you can say, okay, I now know I have this class. So say it's diabetes. You have the class of diabetes or pre-diabetes or insulin resistance, which all fits into one class. And you say, okay, I've got that class. How do I treat it? And you start treating that based on the treatment blueprint. And from there, you now have a really good picture of your peripheral neuropathy. You know your neuropathy score, you know your neuropathy archetypes, you know exactly what your neuropathy looks like. You've got your management playbooks, you're controlling the symptoms. And now you're actually you've got your treatment blueprints, you're knowing where you're going and where you're heading as far as the treatment process is concerned. And then you say, okay, now how do I get from here, from controlling the nerve damage, to really thriving with my peripheral neuropathy? And the way you do that is through really saying, okay, I'm going to take all this previous information that I received, all these previous tests, all these previous informational pieces of the puzzle, and create my personal peripheral, sorry about that, my personal peripheral neuropathy roadmap. Now, the personal peripheral neuropathy roadmap, which is apparently hard to say, is the key to this. And so basically synthesizing everything here into one document that you can evaluate regularly, and you can improve and keep moving forward and keep progressing, so that the rest of your life, peripheral neuropathy no longer has control, but you do. So if you see how this works, what we've done is we've taken you, the one that has peripheral neuropathy, and we've given you complete control of your peripheral neuropathy that's not dependent on a doctor, not dependent on a certain treatment type, and it's not dependent on anything else. It's dependent on you. You're not treating the symptoms, you're treating your nerve health, and you're doing it. You're the one that modifies, and you're the one that changes and says, okay, I need to do a little bit different in this case because this is happening. And through this process of getting to that point, you're going to have the knowledge and the ability to do that far better than your doctor can. We have individuals that this is working for today. We have individuals that are continuing to live their life even with peripheral neuropathy. And one of those individuals is even me. I have peripheral neuropathy, and it no longer interferes with my life. I'm able to go camping. I'm able to go hiking. I'm able to play with my grandkids and my kids. I'm able to do whatever I want. If I want to go running, I can go running. And the peripheral neuropathy doesn't keep me awake at night. It doesn't keep me interfere in any way with what's going on with my life, because I've taken control of my peripheral neuropathy. I want to give you the same control. So the idea is going through this new process. And if you're saying, okay, that sounds like a good idea, that sounds like something I want to do, then the best place to start is to get your neuropathy score. The easiest way to do that is go to the neuropathyscore.com. This is free. You'll be able to take the test and go through the process. It will require you to give your name and email address. That's valuable, because then what we can do is reach out to you and say, okay, based on your neuropathy score, here are the next steps you can do. Here's some things that you can do and actually help you in the process. I'm Dr. Brandt Gibson, and what I really want to do is give you the power to take back control of your peripheral neuropathy. You're the secret. You're the reason that you could get better. And ultimately, let's start. The neuropathyscore.com and start going down that journey that is the Gibson Method. And ultimately, you will live a life exactly how you want it, without the interference of peripheral neuropathy. Thank you. Have a great rest of your night.